Hello there! Let's talk about corticosteroids, powerful medications that can be used in a variety of situations. Think of corticosteroids as the fire brigade for your body's inflammation. They quickly put out the flames, but aren't always the best long-term solution. First, what are systemic corticosteroids? Systemic corticosteroids are medications that affect the entire body, not just one specific area. We use them to reduce inflammation and suppress the immune system. In rheumatoid arthritis, a condition where the body attacks its own joints, short-term corticosteroid treatment can rapidly reduce symptoms. However, for long-term management, doctors only continue corticosteroids after considering the risks and exploring all other options. It's like using a sledgehammer to crack a nut, effective, but maybe a bit overkill in the long run. Polymyalgia rheumatica, causing muscle pain and stiffness, and giant cell arteritis, inflammation of arteries especially in the head, are almost always treated with corticosteroids. Stopping treatment early often leads to relapse. Many patients need treatment for at least 2 years, and some need low doses long-term. Arteritis nodosa and polymyositis, which are rare diseases involving blood vessel and muscle inflammation, are also typically treated with corticosteroids. Systemic lupus erythematosus, or SLE, is another autoimmune disease we treat with corticosteroids when necessary. SLE can affect many parts of the body, and corticosteroids help manage symptoms such as pleurisy, inflammation of the lining around the lungs, pericarditis, inflammation around the heart, and other systemic issues. The dosage can often be reduced over time, and sometimes treatment can even be stopped after a few months in mild cases. However, many mild cases of SLE don't require corticosteroids at all and can be managed with anti-inflammatory painkillers or medications like chloroquine or hydroxychloroquine sulfate. Ankylosing spondylitis, a type of arthritis that affects the spine, generally isn't treated with long-term corticosteroids. In extremely active cases that don't respond to other treatments, doctors might use high-dose pulse treatments very rarely. Now, let's switch gears and talk about local corticosteroid injections. These are injections directly into a specific area for a targeted anti-inflammatory effect. In inflammatory joint conditions like rheumatoid arthritis, intra-articular injections, that's injections into the joint, can relieve pain, improve movement, and reduce deformity. It's like giving that one problem joint a little extra attention. These injections can also provide relief while waiting for longer-acting medications called DMRDs, or disease-modifying anti-rheumatic drugs, to kick in. Aseptic precautions are vital to avoid infection. Sometimes, people experience an inflammatory reaction after the injection. It might be a reaction to the corticosteroid itself, but it's crucial to rule out a possible infection. Smaller amounts of corticosteroids can also be injected into soft tissues to relieve inflammation in conditions like tennis elbow, golfer's elbow, or compression neuropathies like carpal tunnel syndrome. For tendinitis, it's important to inject into the tendon sheath, not directly into the tendon itself. The Achilles tendon should not be injected due to the risk of rupture, because it lacks a true tendon sheath. Hydrocortisone acetate or similar synthetic corticosteroids are typically used for local injections. Intra-articular injections can cause flushing and potentially affect the cartilage within the joint. Doctors usually limit injections to no more than 4 times per year in the same joint. Corticosteroid injections can also treat skin lesions by reducing inflammation directly where it's needed. To summarize, systemic corticosteroids treat body-wide inflammation in conditions like severe arthritis or lupus, while local injections target specific areas like joints or tendons. Both have their place, but understanding their uses and limitations is key. Remember, like any medication, corticosteroids have risks, so it's important to use them wisely and under the guidance of a healthcare professional.